Eahp is a non-affiliate, non-governmental umbrella agency for non-state actors operating in the health sector and interested in the regional health integration in the context of the East Africa Community, EAC. It's a platform with a unique mix of health sector players from business and non-business members from varying orientation and background committed to a shared purpose of facilitating and advancing partnership for better outcome in the health space.
This is Jonaya William Molel, the Chief Executive Officer of the East African Health Platform, in short, Eahp. Today, I will be presenting before you a narration, bit of talk around some of the intervention that Eahp engaged in 2021, around July. And the subject matter was on the workplace policy amidst COVID-19. You all know that 2019-2020, we had a huge global challenge of the COVID-19 disease. And as Eahp, among the other interventions that we did was to look at the working spaces. How have they been impacted by COVID-19, given the measures that were given by WHO, ILO, and many other countries in the struggle to control and manage COVID-19 infections. So within that, Eahp was able to do a combination of a policy review and a dialogue on workplace policies and how that environment has been affected by COVID-19. In terms of the process or our approach, we looked at the review of the documents, especially the workplace policies across the East Africa. Except for South Sudan, we were not able to get many of the documents that we wanted, but this is work in progress. And then we had to do a dialogue in combination with direct interviews, and we sampled Tanzania to start with. We were able to do physical dialogues with different centers. And in those dialogues, we visited different sectors. For example, immigration, the Home Affairs was very good collaborating with us. We were able to visit the Home Affairs in Arusha, in Kilimanjaro. Then we went all the way to Dar es Salaam, visited the marine sector at Azam Marine. And then we went to the hospital setup at Kairuki Hospital. Then we ended in Dodoma, where we had a discussion with the religious institutions at CCT. And then we ended with a high-level policy briefing, high-level briefing with the National Parliament of the United Republic of Tanzania.
Kipekee kabisa leo nipende kutoa shukrani za pekee kwa Eahp ambao wameweza kufika katika jumuiya yetu leo na kutupa elimu ya namna gani bora ya kusimamia masuala ya usalama kwa wafanyakazi hasa katika maeneo ya kazi. Mada hii ni mada ambayo ni ya muhimu sana kwenye jamii yetu ya sasa, na hasa kutokana na kushamiri au kuendelea kukua kwa magonjwa yanayoambukiza kwa namna mbalimbali. Tumeshuhudia magonjwa ya sasa ambayo yanajikita kwenye virus transmission, na sasa tunaendelea kujifunza namna bora ya kuendelea kuwakinga watumishi ili kuendelea na uzalishaji au kuendelea na shughuli pasipokuwa na changamoto mbalimbali. Ni kweli katika maeneo ya kazi ni maeneo ya muhimu sana, ndiko watumishi au ndiko mtumishi anapotumia muda mrefu kuwepo katika masaa yake 24 alionayo ya siku, basi muda mrefu anaotumia katika masuala ya kazi. Basi ni muhimu sana kila mtumishi kuona sababu ya kuchukua hatua madhubuti, lakini kama taasisi kuweka miongozo mbalimbali na taratibu ambazo zinaweza zikamkinga mtumishi huyu katika hali za magonjwa na maambukizi ili kuendelea na shughuli bila kuwa na mkwamo wa aina yoyote.
Out of that, the key outcomes I'm going to be summarizing today. One was that COVID-19 is real. There is no one station that we visited where they said they have not heard of it, or they have not heard of a colleague, a friend, losing a life or losing a life of a dear one. So that means COVID is real. COVID is not something to joke with. COVID hit the world, hit individuals, hit organizations, And therefore, at workplace, COVID is something that has been seriously pronounced. The second outcome is really of a bad news. Given the nature of the workplace spaces, where there is very high congestion in many places, especially the productive sector and extractive sectors, there are high contacts that you can not control because of the nature of the work you do, depending on what you do, especially in hospitals. You have patients, you have different types of clients coming in and out, inpatient, outpatients. You have, the big workforce. There's no way you can avoid contacts with other people. So that means the workplace, the conclusion we're getting out of this intervention, is a real vulnerability point. There's a possibility of contacting COVID at workplace, depending on where you are, different sectors. It is something to look at because it's a real entry point that can either control, reduce, or increase the numbers of infection. But the good news is, given the nature of the workplaces, that they are very well organized, most of them are well resourced, they are very structured. It means this is a potential key area, key entry point for prevention of COVID-19 and other diseases. If they are well resourced, if there are good structures, but also there are good management and leadership policies that are guiding every individual, every unit to be able to protect themselves and the people they serve. And here I'm talking about a client-centered protection mechanism or strategy.
Kwa hiyo ushirikiano huu ni wa muhimu sana, hasa katika kuangalia mtazamo wa baadaye katika suala la afya na ni jinsi gani tunaijenga jamii inayoweza kukabiliana na maambukizi na usambaaji wa COVID-19. Kuhakikisha kwamba tunajenga nguvu ya pamoja kuandaa jamii, kuielimisha na kuweza kusaidia kuondokana na maambukizi ya COVID-19 pamoja na athari zingine za kiafya zitakazotokea kwenye mazingira ya kazi, kwenye maeneo ya shule na kwenye nyumba za ibada.
I want to share some of the realities that are related to workplace policies and workplace environment. If I use Tanzania as a sample, and I want to emphasize here that the review was for the whole of the East Africa. Only for Tanzania we were able to do the dialogues because of the ability to move around. Other countries are to follow. As I speak, we talk about 23 million out of the 55 million of Tanzanians being in employment spaces. And this includes the formal spaces and the informal spaces, which means quite a number of people are really in workspaces and they need to be protected. Otherwise it will be a vulnerability space. Another reality is that out of our lives, for those of us who work, you've got between 8 to 12 hours as a minimum of hours you are at workplace. So most of your time actually you spend it at work, because the rest of the time you're at home and maybe you are sleeping rather than being in contact with other people. Now, depending on where you are, is it a marketplace, is it a company, is it an organization, is it everywhere you are, is it an airport, is it everywhere you are? The number of people you interact with, you contact with, are potentially increasing the possibility of you contacting an infectious disease, COVID being one of them. So this is a key point to take, and therefore re-emphasizing that protection at workplace is critical. And there's a very limited self-care or self-care in terms of how I can control the way I interact with other people. So this means the vulnerability is real, protection is possible, but it takes the employer and the employee to be able to entangle this, including policies that are well managed and resourced, but also including my personal behavior to be able to protect myself and the people I work with, or even my clients. The work that we did will lead to a call of action, and the call of action is based on the reality that many of our workplace policies have been in place for quite a long time. Quite a number of other health-related issues are coming up that needs to be taken into consideration, which means we are calling our government now to not to only think, to act as soon as possible to review the policies that are in place so that they can be able to be up to date, but also take into consideration all these health challenges and therefore be effective, more effective than they are today. The other thing is that employers and employees have to take a shared responsibility and think well beyond COVID-19, because whether COVID ends today or tomorrow, the change is real. The way we think of protection, the way we think of workplace policies and health safety has changed. So this is a call to action for policymakers, for employers, employees, to be able to think further beyond COVID-19 and review the policies together, implement them, because that is another angle, but at the same time, have enough resources to be able to have an environment where a worker will not be really thinking of a possibility of picking a disease on the way going to work, at work, or coming back, and therefore potentially putting into another vulnerability the families at home. This is a shared responsibility. We need to develop systems. We need to put in enough resources, which was a big issue when we went around, that many of the organizations and companies were not really prepared, leave alone the informal sector, to be able to finance the protection, buying protection gears, being able to have enough spaces where people can have distances among themselves, but also sanitization and all that behaviors and practices that are being called for. But also we need endless knowledge and information among ourselves to be able to remind each other what we need to do to be able to stay safe. In summary, safety at workplace is no longer an option. It's not an afterthought. It's not something we are supposed to be planning everything else and then, oops, the national policy requires me to do something as a workplace protection. It is a priority, it is a must. Think of a doctor, how many years and how many months, how many hours, how much money do you have to put in to have an effective doctor, a complete doctor? Now, losing one doctor means losing resources. Now, that is an example. There are so many people, engineers, teachers, everybody. We need to protect them because it means protecting the resources of the country, protecting the people that are having a huge impact on the general population. As Eahp, our next point is to do other dialogues around the East Africa with other countries, whether online or physical, as the time will allow, given the COVID-19 measures progress. But the other thing is that we are going to continue running dialogues among the public and policymakers until we are able to see a changed attitude, a changed environment, a changed policy setup and system that protects the working class, the working people better than it is today. Thank you. I speak for Eahp. We think of borderless health, a lot of movement across the borders for work, for business, and therefore this agenda is a protection agenda, is a peace agenda, is a security agenda. Workplace policies are important, and we must ensure to do all that we can, that our working people stay safe and their lives are protected. Thank you very much.